Hey folks, in this video I wanted to share with you how I got my first choice job in core surgery and scored almost 100% at the interview around my day job as a doctor. I did so well in fact that I ended up setting up an interview preparation business that ranks #1 on Google for core surgery, and I've coached thousands and thousands of surgeons to help them get their first choice job, and I even wrote the top selling book on core surgical interviews, so I know a thing or two about interviews that I want to share with you today. Now, if core surgery isn't your thing, don't worry, as I've added in chapter markers down below so that you can skim through to the more general interview tips that you can apply to any interview, as lots of the medical interview formats and principles are very similar. So hit that subscribe button and let's get into it, starting off with some basics. So what is core surgery? Well, if you're not familiar with how doctors train in the UK, this diagram gives a really good overview. Core surgery is a 2-year surgical training program that happens after completion of foundation training and is a requirement to progress to higher surgical specialty training in the UK. During core surgical training, you typically progress through a variety of surgical specialty rotations to give you a broad experience of surgical principles, with some themed programs offering more placements in things like ENT or orthopedics. I did a program that had 18 months of orthopedics training and then 6 months of vascular surgery because I knew I wanted to do ortho. There are also some programs that offer what's called run-through training, where you don't need an interview to get into higher specialty training after core surgery, and you just run through to ST3, though these often limit where you do your training, with only some regions and specialties offering them. So how competitive is core surgery and how many jobs are there each year? Well, core surgical training is one of the most popular medical specialties, with over 1,200 applicants applying for just over 600 jobs each year. Each region has around 40 core surgery jobs, with London and the Northwest having more, but I'd recommend applying for the region where you're going to be the happiest rather than trying to game the system. Okay, so how do you actually apply for core surgical training? Well, core surgery, like most other medical interviews, follows a national application process. You apply for core surgical training through the NHS's Oriel job application portal. The job listing and application usually goes live in the first week of November each year and stays open for a month, closing in the first or second week of December. When you apply through Oriel, you're asked to enter your personal details of your previous jobs, and then complete a scored self-assessment of your personal achievements. Now, as part of the selection process for 2023 recruitment, all long-listed candidates will be required to take a multi-specialty recruitment assessment exam called the MSRA. This will then form the basis of shortlisting. Only the top 1,200 applicants at MSRA will be invited to the interview. All applicants that score higher than the cut-off score but are not initially invited to interview will be put on a reserve list. Now, new for 2023 selection is the MSRA being used for shortlisting during core surgical training. The MSRA is a 2-hour multiple choice paper sat at a Pearson VUE test centre, and I have a full video covering what the MSRA is and how to pass it, so make sure you check that out. Invitations to book an MSRA test slot are sent out towards the end of December after the application window closes, and the test window is in the first 2 weeks in January, with scores released at the end of February. The MSRA is composed of 2 individual papers, a clinical multiple choice paper and a situational judgment paper. My best advice for passing the MSRA is to make sure you understand how the paper is scored, which you can do by checking out the video on my channel explaining how to do well at the MSRA, and then doing as many practice questions as possible. I've popped up some links to free MSRA resources in the comments below too, and practice really is the best way to do well. The core surgical interview self-assessment asks you to complete 4 sections that correspond to something called the person specification. This is basically a list of the essential and desirable criteria that Health Education England, who set the standards for medical selection in the UK, set out each year. Each section is scored based on the level of your achievements, and remember, you need to supply evidence backing up everything that you put down. The self-assessment for core surgery used to have 9 separate sections, including postgraduate degrees and prizes, but these were removed and other sections were consolidated from 2023 onwards, so let's now look at those 4 sections. Domain 1 is commitment to the specialty, which is broken down into operative experience, where the maximum score is 8 for 40 cases evidenced via a verified logbook. Then you've got attendance at surgical conferences, where the maximum score is 3 for attending 3 conferences, evidenced by proof of attendance certificates. And then surgical experience, where the maximum score is 3 if you've undertaken a 4-week elective in a surgical specialty. Domain 2 is then quality improvement and clinical audit, where the maximum score is 8 if you were involved as lead in all aspects of a surgically themed clinical audit or QI project that demonstrated change and closed the audit loop. The audit must be surgically themed, and this can be evidenced by a presentation given and a letter from the supervising consultant. Domain 3 is then presentations and publications, where a maximum of 10 points is awarded if you've won a prize for delivering a presentation or you're first author on a PubMed cited publication. This can be evidenced by the publication or a letter of acceptance of presentation. And finally, there's Domain 4, which is teaching experience and teaching qualifications, where you get a maximum of 10 marks if you've designed a teaching program, evidenced by feedback forms and a letter from the supervising consultant. There's then an additional 5 points available if you have a formal teaching qualification with a master's level degree, getting you all 5 marks. Now, as you can see, knowing the criteria here early is a huge advantage. I geekily had this list in medical school, so I knew I needed audits and other things that I then had more time to achieve and tick off. Obviously, trying to get all of these areas ticked off in your F2 year is a little bit trickier, so be sure to prepare early. Whatever you score yourself, you need to ensure that you have the evidence to back it up. The evidence upload portal opens at the end of January and closes in early February, and you need to upload your evidence as a single document with an index page through the online portal. So what are the timelines for core surgical interviews? Well, applications open via oral in November and close in early December each year. And then you need to book an MSRA slot and sit the exam in the testing window in January. You then have to upload your self-assessment evidence at the end of January, beginning of February, and the MSRA results are announced in February along with invitations to interview. And then the interviews themselves are held in March, with results announced the following month, when you'll also be asked to preference your jobs in order of where you'd like to work. The core surgery interview is held online using Microsoft Teams and consists of one 20-minute interview station made up of a 10-minute management section and then a 10-minute clinical section. The management section is divided up into 2 5-minute sections itself. In the first part of the management section, you'll be asked to give a 3-minute pre-prepared presentation on a topic related to surgery that's emailed out via Oriel when you're invited to the interview. This is then followed by 2 minutes of questions on that presentation from the interviewers. This is a pretty nice way to ease you in, since you've had a chance to prepare the topic, and the topic is usually related to leadership in surgery or an element of the person's specification. In the second part of the management section of the interview, you'll then be given a management scenario which requires you to think on your feet. This might be something like, you notice your consultant appears to be drunk at work, what would you do? Now, I'll go through on how to answer some of those style of questions later on in this video, so be sure to stick around and do hit that subscribe button for more videos like this. The second section of the interview is then the clinical section, where you'll usually be given 2 clinical scenarios to work through in the time allotted. They tend to use similar topics each year, and they're often based around emergency and post-operative scenarios, and are at the level expected of a junior doctor looking after patients on the ward, so you won't get any advanced operative management questions. There's no break in between the management and clinical questions, and they're asked by the same panel members. The remote panel is comprised of a maximum of 2 consultants, and there may also be a lay representative on the panel whose role is to check for the fairness and consistency of the interview. Prior to the COVID pandemic, the core surgery interview was held in person in London with 3 OSCE-style stations which were 10 minutes each. They matched the online interview with clinical and management 10-minute stations, but they also had an additional portfolio station where you were grilled on your CV and your physical portfolio in person with questions like, why should we choose you? They might bring this back at some point in the future to the interviews, so it's well worth being aware of this, but the format and the scoring is fundamentally the same. The online interviews were felt to be far more cost effective and efficient, but as they're shorter and you don't switch between stations and interviews like in an OSCE, there's more opportunity to mess up or break rapport with the interviewers, meaning it's even more important to prepare. So how is the core surgery interview scored? Well, your total score will be a combination of the MSRA, which accounts for 10% of your score, your self-assessment, which is 30%, and then your overall interview score, which is 60%. The interview itself carries the most weighting, so don't worry if you don't score highly on the MSRA or the self-assessment, as you can still pick it up with a good performance at interview. And this is why it's so important to prepare for the interview well. As you can see from the scoring breakdowns, each interviewer scores a certain criteria out of 6 for the management and clinical sections, with scoring systems mapped against the person's specification. The competitive national selection process can be daunting, and knowing where to start and organising focused practice can be really difficult. The best way to ensure success is to practice as many core surgery interview questions as possible, and to ensure you understand each of the core surgery interview stations in detail. Now, one of my best pieces of advice is to treat the interview like an exam. The core surgery interview will likely be your first proper job interview since you actually applied to medical school. Having coached thousands and thousands of doctors, the people who tend to do the best are the ones who treat the interview like an exam and spend time preparing for each section using books, courses, and practicing with colleagues. For the clinical scenario, this means going over your MRCS notes and practicing questions on common conditions and emergencies. You need to be practicing realistic questions and practicing under realistic conditions, which means lots of mock interview practice. For the management section, you need to practice your presentation, and then you need to work through management questions, of which there are a limited amount. In addition to making sure the content of what you're saying scores points, it's also important to work on your interview technique, which is a skill in itself. Eye contact, speed, and clarity of answers all contribute to how you're perceived at interview. Things like speaking clearly, giving concise answers, and not arguing with the interviewers comes from practicing under interview conditions repeatedly. Now, the people who tend to mess up the interview are those who think, hey, it's just a 20-minute online interview, I don't need to prepare for it. When in reality, it's pretty important, as your whole interview score dictates where you'll be spending the next 2 years of your life, and it also affects your prospects of landing a higher specialty training post too, so it's definitely worth spending time preparing. Just like prepping for an exam, there are a selection of books, courses, and question banks out there to help you practice questions and optimize your interview technique. The more you can practice, the better you'll get at interviewing, and the calmer you'll be on the day. So let's look at the most popular resources out there to help you ace the core surgery interview and get the job that you want. When I sat my core surgical interview, there were minimal resources out there to help people prepare. The main go-to resource was this ISC Medical Interviews book from Olivier Picard, which covered common management and portfolio questions, as well as interview technique. As the core surgery interview has evolved over the years, the book has become less beneficial, but it's still a really good general interview text to pick up. Now, the most popular book on Amazon for core surgery interviews is actually a book that I helped write and which my company published, called Core Surgery Interview. This features a selection of clinical and management questions for you to practice and is specific to the core surgery interview. The other books that I used to prepare for the core surgical interview were the books that I used to prepare for my MRCSB clinical sections, and also the ones I used for my medical finals. In particular, one called Complete Revision Notes for Medical and Surgical Finals. I also got hold of the handbook for the Care of the Critically Ill Surgical Patient course from the Royal College of Surgeons. This gives some nice algorithms and information for managing patients preoperatively. Now, this can be a little bit difficult to find, so I've also put a link down in the description and comments below to some crisp text, as it can be quite tricky to pick up. Now, while books, courses, and question banks are an essential investment, practicing with others doesn't cost you anything, and it's pretty crazy how few people actually bother to do it. When I was preparing for the core surgery interview, I spoke with core surgical trainees who'd been successful in the previous year, and I asked them if they could go over the interview with me and go through how their interview went. Now, it's best to pick people who've been through the most recent set of interviews, as they'll likely have the most up-to-date information, and where possible, try and do this formally rather than informally. So rather than doing it over a beer, try and dress up and practice under time conditions. The problem with practicing with others is that it can be difficult to set up practice sessions, especially if you don't know the current core surgical trainees in your region particularly well. While practicing with peers is good, you want to try and simulate the real interview as much as possible, and this is where mock interview courses really come into their own. With the core surgery interview now being online, Mock interviews are very accessible, and there are a number of free and paid courses that you can sign up to right now. The most useful courses are those that put you in the hot seat and give you a full mock interview and also allow you to observe others while receiving feedback from successful candidates. Full disclosure, the most popular core surgical training course, which comes at the top of Google after any paid searches, is actually run by one of my companies. The course is run by the highest scoring candidates from previous years and has a pretty insane pass rate, as the course uniquely focuses on interview technique and gives you some hacks to be able to deal with any questions that you might be asked. The core surgery interview course costs $277, which can be claimed back on study budget and is held in December and January each year to give you time to act on the feedback. The main advantages of paying for a course are that they most realistically simulate the real interview, and unlike organising something locally or attending a free course, the folks running the core surgical interview course have interviewed thousands and thousands of candidates and coached the top scoring candidates nationally, so they know really well how to boost your interview technique and your overall mark. The Royal College of Surgeons Edinburgh also runs a paid interview course facilitated by consultants that costs £250. This is a core surgery specific course and worth checking out. And some hospitals also run local courses too, but these can be quite variable in terms of the feedback that you'll receive, so make sure you do your homework. Regardless of which course you choose, I'd highly recommend spending some money on at least one mock interview course before the real interview, as it could be the difference between getting your first choice job and location for the next 2 years and getting somewhere where you might be less happy or less well trained, setting you up for failure for ST3 interviews. Now finally, just like preparing for any exam, the best way to prepare for the core surgical interview is to practice as many questions as possible so that you cover most of the questions that can possibly be asked at the interview itself. While books and mock courses will give you some questions, there are also online question banks available featuring hundreds and hundreds of questions with example answers to save you time and effort. These can be accessed on demand on your mobile and your computer. Again, full disclosure, the largest and most popular core surgery interview question bank is owned by one of my companies, slightly embarrassingly. CoreSurgeryInterview.com has questions and example answers covering clinical and management stations and includes actual questions that have been asked at previous years, together with a bunch of other resources. The idea here is that you have a full set of questions you can practice by yourself, or you can give to a housemate or colleague to quiz you on. So how long should you actually spend preparing for the core surgery interview? Well, for me, I actually downloaded the self-assessment scoring system in my final year of med school, so I knew what I needed to hit. This allowed me to focus on picking up prizes, completing full audit cycles, and essentially ticking as many of the points boxes as possible. In terms of preparation for the interview itself, with the interview in January, I started my preparation in November to give myself a solid 8 to 12 weeks of practice. I aimed to do a few hours most days, provided I wasn't on call, and then set up some formal interview practice with successful CSTs, and I attended a couple of mock interview courses in December. For most people, I'd recommend spending 2 to 4 weeks familiarising yourself with the interview and scoring and organising your preparation, and then about 8 weeks doing a mix of solo prep and formal mock interview practice and an interview course in maybe December or January. Now, the core surgery interview can be pretty scary, as it's a pretty big deal in terms of your career and likely the first interview you've done since med school. So let's look at my own core surgical interview. For me, just like an exam, I made sure I booked my interview slot early so that I got a mid-morning slot that was convenient for me, and I made sure I got a good night's sleep the night before. For the management station, my presentation was on leadership in surgery, and I tried to make this personal, talking about my own experiences of leadership to try not to bore the interviewers who'd be hearing the same presentation from everybody on the day. The presentation goes very quickly, and I'd practiced and practiced, so I was bang on time. The follow-up questions were then about my opinions on how leadership could be taught and how it fitted into wider surgical teaching. As a quick aside here, having coached loads and loads of the highest scoring candidates, there really is no excuse to not get 100% on the presentation section of the interview, as it's given to you in advance. If you don't practice enough and run overtime, or you run too short, you'll absolutely kick yourself after the interview. If you're struggling, the team at CoreSurgeryInterview.com can also help you to nail the presentation at the course and online. The Royal College of Surgeons also has an ebook that they've published on surgical leadership, which is well worth a read. However, I'd try and keep your presentation original and personal to help differentiate yourself from everybody else on the day. For the presentation section, I'd suggest planning out your presentation well in advance, either using bullet points or writing out a full script, and then practice so that you get actually bored of giving that presentation. You should time yourself repeatedly and make sure you finish on time. If you know you talk quickly or talk slowly, think about how this will be affected on the day, and once you've mastered the content, make sure you focus on your actual technique, changing your voice inflection, and looking at different people on a camera to make sure that they feel rapport. For my management questions, I was given a scenario where I'd run a lumps and bumps list, and then some of the patients had returned with superficial wound infections. This explored my knowledge of error reporting, surgical hygiene, and surgical error root cause analysis. The second part was then about how I'd balance timetabling training in theatre with ward work if I was responsible for SHO training, which was all about organisation, patient safety, and negotiating with colleagues. My top tip for the management station is to utilise frameworks like SPIES, CAMP, and STAR so that you've got a structure to work through the scenario. These are outlined in more detail in the Core Surgery Interview book and the ISC Medical book if you need a little bit more information. Putting patient safety at the front of any management section answer is key, and there are a limited number of things that can come up. So jumping into books and question banks will put you at a huge advantage over people who just don't prepare for this section at all and try and wing it. Now for the clinical section, my clinical scenarios were an upper GI bleed that I was asked to assess in A&E, and then a patient with a post-op arrhythmia secondary to an electrolyte imbalance. My advice here is to follow a safe ABCDE approach, treating life-threatening things first. The interviewers will jump in to keep you on your toes with quick-fire questions, and they'll push the best candidates. So if you don't know everything, that's fine, provided you're safe and you worked your limitations, asking for senior help and support when needed. Remember, the role of a core surgical trainee is to identify unstable patients and initiate early management, and you aren't expected to take the patient up to theatre and then talk through an operation. Overall, the interview goes really quickly, and provided you've put in the effort and prepared, you'll hopefully do really well. Having sat on the other side, the interviewer's side of the table, there's a huge difference between the people who've spent time preparing for the interview and those that haven't, and this is reflected in the range of interview scores. So start early, practice as much as possible, and invest that study budget into your preparation to get your first choice job where you'll be happy for the next 2 years of your life. Practice your knowledge, practice your interview technique, and you'll do fine. Thanks so much for watching. Do hit those like and subscribe buttons for more deep dive videos, and I'll catch you again in the next one.